Next, may I call upon stage Dr. K. Madan Gopal, Senior Consultant, Niti Aayog. And may I also invite the Mentor-Mentee Program researchers, Dr. Sunali Jadhar, Dr. Sulochana Devi, and Dr. Anupama Sharma. I would now like to invite Arun Nair, Senior Technical Specialist, Health Financing at Access Health International, to talk about the Niti Aayog IHSC Access Health International Mentor-Mentee Program.
Thank you. Can you please put the slides? Good afternoon and welcome all. This is a very brief session on the capacity building initiative, which is a recent capacity building initiative of IHSC, and this is a collaborative effort of IHSC with Niti Aayog and Access Health International in facilitating capacity building of young and mid-career researchers, and this is the latest one which we are doing. Earlier ones were also detailed in the previous presentation. Next slide, please. So this program is called the Mentor-Mentee Program, which is a Niti Aayog, IHSC and AHI program focused on building capacities of young and mid-career researchers. And next slide, please. And the context of the program is basically to connect with young researchers who will be not only in leading public health institutions, but institutions across India, like IITs, IIMs, or community medicine departments, and other institutions, standalone institutions, to have a mentorship with a senior academician as well as the policymaker. So it's a unique program in that way. Why the larger idea behind this program is basically, as we all know, research is also time-consuming, expensive, and there are not many research grants that are available for young researchers. So this is an attempt after our first two rounds where Professor Venkatraman and Murli sir described, of having 12 research studies and outputs with academic institution. This is a way of also supporting research as well as building the capacity of young researchers. And the most important aspect is to commission policy relevant research. So the idea is that from the beginning you support young researchers to work on those areas which are relevant for policy making, which are relevant to evidence-based policy making, and help build their capacities in that manner so that they can inculcate later this approach even when they do at their state level or at their institution level. And another component also is to publish these outputs, that we give an opportunity to all these researchers to publish these outputs as research briefs, and which can be used in the long term. And through this process, we are also aiming at building a cohort of young researchers or young and mid-career researchers who can later lead the efforts of IHSC in building the health system community. So, can you go to the next slide? Yeah. So, next one. So, this is the overall approach of the program. This entire program has been conceived with these in collaboration and support of Niti Aayog. And you have a mentor and a mentee and a policy maker, and the ultimate outcome is to come up with a policy brief. So, we have identified, like Maulik mentioned in the earlier thing, we have identified these youngsters through a transparent process, and the selection process also was done through a due process, and each of them were given an opportunity to either select a mentor, or we give the support to have a mentor who will guide them through this entire process. And one more thing, one more aspect is to have this we conceived as short-term research grants. so that you can reach out to more multiple researchers and conclude this within a smaller period of time and have a published output. So we have around 14 research topics, and of which 11 are currently completed, and the way it was done was that it will be completed in a period of 3 to 4 months with the support of the mentors. Next slide, please. So this is the overall element of the entire mentorship program. As I mentioned, the entire leadership of the program was provided by the NITI Aayog in identification of the policy relevant questions, what are the research gaps which are needed and where the research could be done. And the execution part was carried on by IHSC Secretariat and AHI, where the entire process of getting the research concept notes were done, and it was gone through a rigorous process of review, and the selection was done. And even in the 3 months of support which these young researchers got, IHSC supported in the entire execution. And the best part of this is an interrelationship between the mentor and the mentee, and all the mentors are senior academicians, and they all did the work on a honorary basis. It's not having any contractual relationship. It's like supporting these youngsters in getting their research study out. And during the exposure, we also made sure that there is a dialogue process through which multiple sittings webinars were conducted, and even with NITI Aayog, while doing the research to get the inputs, and so that it becomes policy relevant and useful to the policymakers. And the funding, as I said, it's a small grant. It's almost USD 5,000 support from the BMGF, and that's how we packaged it so that we can complete it within a period of 4 months. And last, of course, the publication. Next slide, please. So as I mentioned, we have 14 research topics, from where currently we have completed 11. And the entire process was, like I mentioned, involved interaction with the policymakers. Now, to give more detail, I would request Dr. K. Madan Gopal, Senior Consultant with NITI Aayog, who was instrumental in the design as well as forging this partnership, to say a few words on the program. Sir.
Thank you, Arun. One of the important things which led to conceptualization of this program was the capacities of the researchers in the country. You can think of the capacities and what kind of research we are doing. Are we asking the right questions? Are we giving the right topics? Are we doing the research on time so that it can influence the policy? Timing of your findings is very important, otherwise it will find a way to the bookshelf and nobody will listen to whatever you are saying. And timing is very, very important, and we have to be, because we did, I'm just citing an example before I talk about the collaborative. We were anticipating an extension of NHM from 2021 to 26, the 5 years period. And we thought that we should be utilizing the time in bringing out few of the governance and the other issues. And we put our foot down, NITI Aayog, along with in the leadership of Dr. Paul. We tried to influence, try to bring out changes. If you talk about the way the health system has evolved, we all talk about the Health and Wellness Center, we talk about PMJ, but we don't understand what was the strategy and other things behind that. When India was the signatory, I'm just giving a background so that we understand that in what context we are talking about the health system strengthening. When we were the signatories to Health for All, way back in 78, there was an approach which was decided, which was agreed, that we would be following a primary healthcare approach with 8 elements. If we are able to follow this primary healthcare approach, we would be able to achieve the Health for All targets and the things. But we made some dent into the achievement of the targets. Then there was a revised thinking. The goal post was raised. Then we had the Sustainable Development Goals. Then we have revised our strategy. We told that we would be following the strategy, and we see that how we. As a result, there were few vehicles in the form of National Health Mission, the RCH1, RCH2 program, NRHM, NUHM mission, which ultimately led to NHM mission. Then we thought that when the goalposts were further shifted to the SDGs, that is 2030, then we thought that instead of a primary healthcare approach, where we were providing 6 services to a network of sub-health centers and the system, then we thought that the services have to be comprehensive. So it was upscale to have a comprehensive primary healthcare program. And with the existing structure, there was reclassification, but though it was too early, without having a pipeline of the community health officer, we rolled out the comprehensive health scheme through the health awareness. So that's a different story. But once we are doing research, we have to find out that the timing is very important. It's not the jargons and other things which we are using and just picking up that thing. I was listening to the previous thing that we were talking about the community health volunteers, and now we would be all talking about these ASHA workers. But nobody is bothered to talk about the system which we have created over the last 60, 70 years. That is the healthcare workers, that is health workers, male, female, the health worker supervisors, the MOPSC, the CSC. For the last 20, 30 years, we have been talking about FRUs, but where are the specialists? Are we able to do any research on that? No. We are so much obsessed with the extension of the services, but what about the system? We are talking about the health system strengthening, but no research is saying that how to galvanize the system which was already there. So that's a different thing, that's a different argument. But once it came, we thought that we should be building capacities, young capacities, with a form that the people who are in the field, who have having academic background, so that if we can link that young researchers with them, so that whatever training which these academicians, the experience which they are having, they can at least translate that thing, because we are all nearing to the fag end of our careers. We should be building a cadre of people who can at least take the research forward, baton forward, and carry out the research which is useful and which can contribute to the transformation of the people, transforming the lives of the people. So we have to focus that. That's why when Access Health came to us, we jumped to the idea saying that yes, you are doing this thing, because this is a space which is vacant. This space is not occupied. Previously, few attempts were made, but this space is still vacant in the country. The research space, to give. We are engaged with ICMR also. We have been engaging with other organizations also, but we should be having young talent which is there. If you look at the way Niti Aayog works, we are having a young talent, young professionals are there, lateral entrants are there, that kind of thing. So that lateral thinking as well as a mixture of the experienced people, they can transfer whatever they have learned, and the young people will bring out-of-box solutions to the problems which we are encountering. So this mix of this mentor-mentee program and Access Health approach, then we thought that we should be collaborating with the collaborative, so that we can build on few of the mentees, so that they can take the research thing forward. As a result, in the first phase, we are having 14 programs, though the timing is more or less is over, because we wanted to have this thing before the things came for comments to us. Because EFC notes and other things come, we wanted to influence the EFC notes and other things. That's why we have given these topics. But the timing is such that the research are still in pipeline. We are yet to see the results of that research. And as a result, whatever understanding, whatever field visit which we do at Niti Aayog, we have to influence the policy based on our understanding. That's why the key for all the research and other things is the timing. If you are able to match the timing with the policymakers, the other people, then the research will at least provide some insights and other things. That's an area where we will try to work on with the collaborative, see that how we at least reduce this timing and other things. I will stop here. Thank you very much once again for this opportunity and for patience listening. Thank you.
Thank you, sir. We have with us three MMP researchers. I now call upon Dr. Sunali Jadhar. She is the principal of Ramaiah Nursing College to speak her experience on the program.
A very good afternoon to one and all. I am Dr. Sunali from Ramaiah Institute of Nursing Education and Research, Bangalore. I was very happy to be part of this mentor-mentee program that IHSC offered in collaboration with the Access Health International. And I want to thank them for giving us young researchers an opportunity to be part of the policy-making research and learn it from our mentors. I would like to mention that I was guided by Dr. Ram Prasad Arkalagod, who is a professor in information and decision-making sciences from University of Illinois, Chicago. He's a professor emeritus. Currently, he works as a director of Ramaya Public Policy Center in Bangalore. And connecting me, a mid-career nursing person, with a professor from Information and Decision-Making Sciences who heads a policy center was something very unique. I think that's what IHSC could do to bring out good research. It helped me grow in terms of my research capacity, and it actually helped Dr. Ram Prasad to get more aware about how nursing really works in this country, I feel. We have very brief time given to us. Our research work is put up as a poster presentation outside. I would just like to mention the topic of my research. I worked on developing a framework, an ontological framework, to do a content analysis of the undergraduate nursing curriculum for its content on NCD risk reduction education, because we felt that was very important at this point of time for the country, where 47% of the country's health workforce is nurses, and they are closely involved in educating, because NCD prevention is basically behavioral change counseling, and that takes long time. It requires patience, and it requires people who will be in touch with communities constantly. So I feel nurses are best suited for these roles. A brief poster presentation on our work is displayed outside. You may take a look. Thank you once again. I want to especially thank Mr. Tushar and Mr. Maulik for being a constant source of support. Thank you.
Thank you, Dr. Sunali. I request now Dr. Sulojana Devi, who is Assistant Professor, JSS Medical College, for her remarks.
Yeah, I'm Sulojana. I'm a mentee here, and my mentor was Dr. Balasubramanya sir from NHSRC, and policymaker that is from Niti Aayog, Dr. Rakesh Agarwal sir. Now, just one thing what I wanted to say is, we are the young researchers in the mentor-mentee program. My mentor, like Dr. Balasubramanya sir, like it's like one-to-one. They handholded us. We will be doing the research. There are so many papers, and we, in being in academics, we read so many articles, we read books and all. But the thing is, he handholded, means how sir helped me is, we did the research. My topic was to find the barriers and facilitator in this e-Sanjeevani teleconsultation program. I gave him the reports like this, and he told, this is the barriers. Yes, sir. Then solutions. And I told him, sir, I did not like focus on the solution. You have come up with the barriers from the field. Ask them only. That they have the problem there. Ask them the suggestions. Then give us those suggestions like and themes. I thought like, yes, sir. These were the simple things what he taught us, and I thank him. And all this collaboration of mentor, mentee, and the policymakers, this collaboration was happened because of the structure planned by IHSC, our IHSC and Access Health International. Thank you very much for giving this opportunity. Of course, I know I'm not able to speak also. So many big dignitaries. Thank you very much for Tushar sir and Maulik sir who helped us. Thank you all.
Thank you, Dr. Archana from NHSRC. Sorry, Dr. Anupama Sharma from NHSRC.
It's okay. So, first of all, I want to congratulate IHSC for bringing this platform when so much of discussion is going around global healthcare at a global level on healthcare financing for primary healthcare, even the Lancet Commission on Primary Healthcare Financing. So I'm Anupama, as mentioned, and I'm external assessor for NQuas, Lakshya, and Kayakalp with NHSRC. So this was a very interesting study, which I was able to do with the grant from IHSC, which I'm thankful, where I can collaborate both my NHSRC experience during field visits and also at the same time look at the other side of the study on the telemedicine. So my study was on the telemedicine services with respect to quality, standardization, accessibility, affordability, and referral mechanism. My mentor was Dr. Sood from CDAC Mohali. He's the the director of eSanjeevani. So we worked together on first the design of the study and implementation. And there was a lot of findings from it. We did an extensive desk review on the policy issue when we looked at the various guidelines from NMC to Clinical Establishment Act to NDHM blueprint and IT Act and other and so on and so forth. And at the same time in the methodology, we included the prescription audits where we compare the two, manual as well as the e-prescription audit, and as the patient experience. So, and during the study, as I was doing audit for NHSRC, I was able to visit some of the best health and wellness centers, telemedicine centers in Kerala, and also in Andhra, which are the top 10, among the top 10 leading states when it comes to eSanjeevani. So it was a very good experience. I was able to speak with the leading program heads of eSanjeevani in the 10 states. And we were able to present the outputs and, of the study to Niti Aayog, and we received interesting inputs, different angles on the policy side of it, and the policy issues, and overall also on the next research agenda. We should take it up when it comes to digital health space in India. So, so to close it, it was a learning experience and very enriching experience as a researcher for myself. Thank you.
Thank you all, and I request. Thank you all.